Today's presentation is on how to do a series of Class 2 restorations. This is probably the bane of every dentist's existence, but it needs to be done. I always refer to it as a necessary evil. But anyways, we have to do these. So how do we do them so that they are done efficiently and also done well? We like to have convex shapes to our interproximal walls, and so we use the sectional matrix system. So when we assemble this, in this case, what we'll do is actually have two options. We can either go ahead and set up the matrix system and do just the, say, second molar first, get that one completed, then disassemble the system and go up and do the premolar and get that one taken care of, and then disassemble the system and then reassemble it again to get the MOD on tooth, or at least on the first molar in this case. That's option A. Option B is you could assemble the sectional matrices so that you have this back-to-back setup, which I'll describe here in a second, where you get the MOD on tooth on the first molar taken care of. Then you can disassemble the whole thing and then set it up, say, on the second molar, get that one done, set up on the premolar, and then get that one done. And then in the end, everything should fit well and function the way that it should. It's tempting to want to go ahead and, once you have the whole matrix system set up, to just fill them all at the same time. But of course, as you know, if you do that, when you subtract out the matrix systems at the end, there's probably going to be a good chance that you can have an open contact. So even though this way would take longer, it's not going to be as risky as if you were to just do them all at the same time. Now when it comes to other matrix systems, there's like the Toffelmeyer system, or at least we have a band with some kind of device that tightens the band around the tooth. That was the one that I learned 20 years ago when I was in school, and it works really well, except for the problem I have with it is that they don't have a curve to it. You can see this in this example. If I just take a system like this and tighten it around the tooth, that when it gets done, the flat edge a flat edge is created along the mesial and distal wall. Especially in this case, you can see the mesial wall is very flat. And then when you try putting wedges in there, I've noticed that sometimes when you put the wedges in, the occlusal component actually kind of flares out. And so you can go ahead and try to stuff that filling in there. The problem you're going to have, though, is afterwards you're going to now have to try to make that look like it's convex, instead of being flat. And that can take quite a bit of time, and if you carve away too much, now you have to make the next filling stretch over even further, and it can really distort the interproximal contacts between those two teeth. The other thing that I've learned over the years is that if you do have two interproximal fillings that are facing one another, if you just put in one sectional matrix and fill that one, then take it apart and then put in the next one when you go over to the next tooth, the problem you run into, or the risk you run, is that perhaps that sectional matrix may have bled over too far into the neighboring tooth, or maybe not far enough, but usually it bleeds over too far, and once again you find yourself having to carve back that interproximal wall in order to make the next matrix fit in there correctly. So I put in two matrices at the same time, one on the mesial, one on the distal, and I call that setting it up in a back-to-back fashion. That keeps the two different matrices in check so that when you go to fill, you're going to have the right placement mesial distally of the target tooth that you're working on. Okay, now let's talk about the actual shape of these sectional matrices. Of course, the walls are convex and concave, but you also have a part that's cut convex and concave. So which one goes where, as far as, do you put the concave part gingivally, or do you put the convex part gingivally? There's two schools of thought. There's one that says you should put the concave part gingivally, because when you then wrap that around the tooth, that concave part is going to constrict tighter and will allow for more of that rounded shape. But then you don't have the extent that the convex surface would have. So you can put the convex surface down, and it too will allow for a nice convex shape when you're all said and done, but you do get that gingival extent that goes down and really seals off well. I've done it both ways, and the way that I've been doing it now for years is I put the convex part subgingivally, and then I go and place my wedge, and then put my bite tie and rings in place. And so that's the setup that I use. And every once in a while I'll run into a case where the area of decay went down even further subgingivally than what this traditional sectional matrix will reach to. So I have to get this other one that's actually made by Garrison Dental. That blue one that you see has the extender tab on it, and that sometimes can pick up that last extra half a millimeter or 3/4 of a millimeter beyond where your normal matrix would fit. And this has really bailed me out of a number of cases. Those are more compromised cases, and of course the patient needs to know that, but this can help you out clinically when you're doing some of those more deeply decayed circumstances. Other thing too to look for is when you do place these bands or these sectional matrices into place, you need to inspect it with your mirror to make sure that nothing got bent during the process. Sometimes when you're inserting these, especially in the back-to-back, or even if you're going up against a neighboring tooth, you may form a small little dimple in the matrix band itself. Sorry, I say matrix band, but you know what I mean, the sectional matrix itself. If you do that, you're going to have to burnish that out to make sure you don't end up with some kind of concave dimple in your restoration. Or it's better yet to just take it out and put a fresh one in there and see what might be causing it. Fix that problem and then reinsert one so that you get just the most ideal, pristine sectional matrix that you can. However, there are times when you place the sectional matrix, you put the wedge in and the bitine ring, and then when you go look down on top of the occlusal surface, you notice that the actual matrix isn't reaching the neighboring tooth. And if you fill it that way, obviously when you take it all apart, the springing action of the bitine ring isn't going to be enough to make up for that difference. You're going to have an open space and a food trap. So you have to somehow pull that over. A lot of times you can just use a plugger to get that done, but there is another instrument that you can use, and it has this kind of funny shape to it and has a clear platform on the top. And what happens with this instrument is you go ahead and you put your flowable composite down at the bottom, you put your first layer of your normal hybrid compactable composite, tap that into place, and you take this instrument and put it down, and you don't really want it submerging into that composite. You want it just barely touching, just enough so you can take that tip of the instrument, pull towards the neighboring tooth, and then you can take the curing light, go on top of that flat platform and cure that, and then take that instrument back out, put the curing light back in, cure it all the way, and then fill it up in its normal incremental fashion that we always do. Other thing to point out is that the bitine rings have got different lengths to them. This is when we're getting things set up for a mesial and a distal. The tall ring goes over the short ring. That way you can have the right height when you're putting these together. What do you do when you have a tooth where you have a crown prep and then you have to do an interproximal filling next to it? Again, if you put just the band around the interproximal tooth, you're still going to have that same problem of having a flat wall that may not have the right contour to it. You could go ahead and, I guess, make the temporary and then trim the temporary and do it that way. You could maybe prep the tooth that needs a filling, get that prepped first, and then go ahead and do the filling and then proceed with your crown prep. That's another way of doing it. Or what you could do is, what I found is you can take a band, put that around the tooth, but in order to counteract the that flat wall, you can actually slip a sectional matrix that has that kind of stronger metal with the preformed shape to it. You can slide that inside of the band itself, kind of loosen the band enough so it will fit in there, and that way you get the benefit of both having the band tightening around the neck of the tooth so that you have a nice gingival seal, and then placing the sectional matrix allows it to even have that form of what you want when it's ultimately put in place. So kind of doing this, kind of setting it inside the other matrix, a matrix within a matrix in this case, can really help kind of bail out those situations. Another problem you can run into with doing Class 2 restoration is that the prep itself may not lend itself to a good gingival seal. I have found that if the buccal or lingual wall isn't properly shaved the right way, it will allow the matrix band to kind of stick out away from the tooth and away from the gingival part in particular, and won't allow a very good seal. So going back and shaving off that buccal and lingual margin of the cable surface margin and making sure that when the band, or I should say the sectional matrix, fits down into that area, that it's actually going to adapt to the entire cable surface margins, both buccal, lingual, and gingival. However, there are some cases, because of a root concavity, you just simply can't get a good seal, or it's just not going to adapt as well as you'd like, but it's very, very thin. In those situations, you can actually put a little bit of composite, take your instrument, your probe, smear it along there to kind of create that seal, zap it with the light, then go in and do your normal composite stacking like you normally would do. If the space is too large, then that's a much bigger problem. You should maybe start considering doing a crown at that point. But if you really need to do the filling, you need to accomplish two things. You need to get both the gingival seal taken care of, but you also need to reach the neighboring tooth and close the contact. So sometimes you have to do that in two phases. Maybe the first phase is you put a band on the tooth, get it tightly wedged, put down your composite to get that seal, start building it up, take that apart, put in a sectional matrix. Now you can extend over and touch the neighboring tooth while also adapting the gingival seal against the composite you just put in place. That takes much longer to do because you're doing it basically in two steps, but in those kind of unique clinical circumstances, you can do that, and it usually works out fine. Not the best, but it works out enough to get the job done for the short term. Anyhow, hopefully that all helps. Class 2s, again, are not the most fun thing to do, but hopefully with these little tips and tricks, it'll make them much more predictable and get better results. Thanks.